If you have neuropathy, you've probably been told the problem is your nerves. And that's true, but it's incomplete. Because here's what most people never get explained to them. Nerves don't fail randomly. When one nerve fails while the others stay healthy, there's usually a reason. And that reason is not always what you think. Today I'm going to walk you through a framework that changes how you understand nerve damage, where it comes from, why it affects some people more than others, and what actually has to be addressed if you want to recover. Now, when most people find out they have nerve damage, they assume the problem is inside the nerve. The nerve is damaged or the nerve is broken. And because of that assumption, every solution they look for is aimed directly at the nerve. Medications, supplements, treatments, all aimed inward. But that assumption, it has a flaw. It ignores the environment the nerve is living in. And nerves don't exist in isolation. It runs through tissue. It passes through tight spaces formed by bone and ligament. It bends around the joints. It gets stretched, compressed, and loaded throughout the day. It shares space with tendons, muscles, and fascia. And when that environment becomes hostile, the nerve fails. Not necessarily because the nerve itself is diseased, sometimes because the conditions around it have made normal function impossible. In neurology, we often see what's called a focal neuropathy or focal nerve injury. One specific nerve in one specific location is failing while the nerves around it are functioning normally. Now that's a clue. If the problem were purely systemic, purely a blood sugar problem, purely a circulation problem, you'd often expect more widespread symmetric damage, maybe both feet or both hands equally. But focal failure tells you something local is happening. The nerve is being compressed or stretched or entrapped or loaded repeatedly until it can no longer recover. That's mechanical load. And it's one of the factors that can be overlooked when people are trying to understand why symptoms persist. And once you understand that, you start seeing examples of it everywhere. Now, everyone has heard of carpal tunnel syndrome. The median nerve runs through a narrow tunnel at the wrist, formed by bone and ligament. When pressure builds in that tunnel, it interferes with the nerve's ability to function normally. So, you get numbness, tingling, and weakness of the hands. Same nerve, different environment, completely different outcome. Peroneal nerve compression happens at the outer knee, often from prolonged crossing of the legs or sustained pressure against the fibular head. The result is numbness along the top of the foot and the outer leg. The nerve isn't diseased, it's being mechanically compromised at a specific point. Both are the same story, a nerve under load in a hostile environment failing at the point of greatest stress. But here's the question that matters more than any of those examples. Why does one person develop symptoms from the same compression while another person doesn't? Two people, same position, same mechanical load on the same nerve. One develops numbness within minutes. The other sits that way for an hour and never notices anything. The position isn't different. The nerve isn't being asked to tolerate a different load. What's different is the reserve capacity of the nerve itself. The nerve that fails first isn't always the most damaged nerve. Sometimes it's simply the nerve carrying the greatest load with the least reserve capacity. This is the framework I want you to understand. Every nerve has a capacity, the ability to tolerate stress and recover from it. And against that capacity, there are loads. Mechanical load is one of them, but it is not the only one. There's metabolic load, the strain placed on nerve tissue by blood sugar dysregulation, insulin resistance, and impaired cellular energy production. There's vascular load, the reduction in oxygen and nutrient delivery when circulation is compromised. There's inflammatory load, the chronic low-grade tissue inflammation that alters the nerve chemical environment and interferes with normal signaling. All of these push against the nerve's capacity to function. Most people spend all their energy looking for the thing that damaged the nerve. What they should be asking is, what is consuming the nerve's capacity today? Because capacity determines how much load a nerve can tolerate before it fails. A healthy nerve, one with full reserves, can absorb a significant amount of combined load. The compression from crossing your legs, the metabolic stress from poor blood sugar regulation, the inflammatory state from poor sleep. Individually and together, a healthy nerve tolerates these and it recovers. A compromised nerve cannot. When capacity is already depleted, when metabolic stress, vascular compromise, and chronic inflammation have already consumed the nerve's reserves, there is nothing left to buffer mechanical load. So the same compression that a healthy nerve shrugs off and becomes a thing that pushes compromised nerves past their threshold. That's why symptoms are often worse in one foot than the other. That's why they flare after certain positions, certain activities, or certain shoes, things that seem completely unrelated to blood sugar. That's why patients say nothing obvious has changed, but everything got worse. Something local is loading a nerve that no longer has the capacity to absorb it. If you've been treated only for the metabolic side of neuropathy, blood sugar, circulation, nerve supplements, and your symptoms haven't fully resolved, this is one of the reasons why. The possibility of a mechanical component hasn't been fully evaluated. The full load picture hasn't been assessed. And if you've been treated only mechanically with adjustments, decompression, physical therapy, without addressing the metabolic and vascular environment, you're restoring capacity on an axis while leaving the others depleted. Both sides of the equation matter. A nerve that is mechanically compressed and metabolically compromised needs both addressed simultaneously. So remove the compression and the nerve still can't recover if it doesn't have the metabolic resources to rebuild. Restore the metabolic environment, but leave the mechanical load in place, and the nerve is still being pushed past threshold with every step. Now, the framework isn't mechanical versus metabolic. It's load versus capacity. And meaningful recovery requires that you understand both sides of the equation and address them together. Now, that's what we evaluate. That's what we build treatment around. Healthy systems tolerate stress. Compromised systems do not. The question isn't just what's wrong with the nerve. The question is what's consuming the nerve's capacity. When one nerve fails while the others stay healthy, that's not random. That's a signal. It's telling you that something specific, something environmental, is happening to that nerve at a specific location. Understanding load versus capacity doesn't just change how you think about diagnosis. It changes what recovery actually requires. Now, if this gave you a clearer picture of what may be driving your symptoms, share it with someone who needs it. And if you want to understand the full framework we use to evaluate and treat neuropathy, contact us directly.